Hello everyone, and today, as promised, short revision series has been starting. I'm starting the short revision series, and we'll be covering some important points that will be helpful for you in the exam. So, important surgical criteria, stagings. See, the Rosemond criteria is used for the endoscopic ultrasound classification for chronic pancreatitis. Now, Milwaukee's classification, it is for the sphincter of ODE dysfunction. Now, Masoka's staging, it is for thymomas. Now, AIMS 65 scoring is for upper GI hemorrhage. P POSUM is for production of morbidity and mortality after surgery, and HPS score is for acute pancreatitis. So they are very important and nowadays very much asked. Now, important eye signs in Graves' disease. Now, Stilwell's sign, it is infrequent blinking, and it is the mildest sign seen, and the toxicity. And exophthalmos is a protrusion of the eyeball, and Darien-Pulse sign, it is lid retraction due to the spasm of Muller's muscle, that is the autonomic component of LPS. Now, Von Graeff's sign, it is lid lag. Now, Joffrey's sign, it is absence of forehead wrinkling when the patient looks up. Now, Mobius sign is severe involvement, and it involves the medial rectus muscle and loss of accommodation reflex. Now, these are the points which are commonly asked. They frame these points in sometimes in a clinical question also, so you need to remember these. Now, different types of keratin precipitates, KP, and now mutton fat KPs. They are composed of epithelioid cells and macrophages, and they are seen in granulomatous uveitis. Now, granular KP, they are composed of lymphocytes and non-granulomatous uveitis. They are seen in non-granulomatous uveitis. Now, fine KP or stellate star KPs, they consist of endothelial dustings, and they are seen in Fuchs heterochromatic erythrocyclitis. Now, old KPs, they are signs of healed uveitis, and red KPs, they are acute hemorrhagic uveitis. So they are seen in acute hemorrhagic uveitis. Now, the branches of external carotid artery, there are 8 branches of external carotid artery, 3 anterior branches, in which superior thyroid artery, lingual artery, and facial artery are the common anterior ones. Posteriorly, 2 branches, occipital artery and posterior auricular artery. Now, medial one branch, that is ascending pharyngeal, so this is important. Terminal, there are 2 branches, maxillary artery and the superficial temporal artery. Now, one important point that sometimes they ask that tonsils are supplied by the tonsillar branches of the facial artery, and facial artery is the branch of external carotid artery. So this is a question, so please remember this. Now, this is a chart seeing the lipoproteins, lipids, and the apoproteins. So the lipoprotein is chylomicron, that is consists of triglycerides, the lipids, and apoprotein is ApoB48. Now, only that. Now, chylomicron remnants and triglyceride plus cholesterol, and that is the apoprotein is ApoB48 plus ApoE. Now, VLDL, the lipids are triglycerides, and ApoB100 is the apoprotein. So these are very important, very frequently asked, very important. Now, LDL, the lipid is cholesterol, ApoB100 and ApoE is the apoprotein. Now, HDL, cholesterol ester, ApoA, ApoC, and ApoE. These are the apoproteins in this. So there is a 4 more to come. This is the first video, and you can suggest me what else can I add in this short revision videos. So I hope you liked it, and the suggestions are welcomed in the comments. So please comment and tell me if there is something missing. Thanks.